Hi, I'm Dr. Top. Today's topic is the principle you have to know before you jump to the hair transplant. In Thailand, I can say five philosophy about the hair transplant. Let me recommend myself. I'm Dr. Top. I'm diplomate American Board of Hair Restoration Surgery. I was always invited to be a speaker around the world in US, European countries like Spain, Monaco, and so many countries. Even though in Japan and Korea, I was invited to talk about the nano fat and hair transplant jelly all year round. Today's topic, the first thing you have to know is our philosophy. We have to use few graft to transplant. Why not? Because so many patients they don't know when we take the graft out, they thought, hey doctor, I want to transplant 3,000 grab, 4,000 grab, 5,000 grab. Can you do that for me? I said no, because when we take the graph out, the graph will not record. That's why we have to use the graph as less as we can, but we have to optimum the result. If you take it too much, what happened? I show you the next slide. This is the one of the slide. This is the over harvest. If you have the condition like this, it's very difficult to treat. This is the one thing you have to know. The second thing is, doctor, I want to get the lowest hairline as you can do. I said, no. Please, you have to measure the proportional. We have the like a metric. I show you from from this sample. We have to measure. This is the golden ratio or so many things. But we have to maintain the hairline as like a proportional and reasonable. Why not? Why not make it? If you make it too low, I show you next slide. You get the problem because hair loss is progressive. Hair loss is unpredictable. That's why in this guy, in this patient, you see the transplanted hair is on the front, but on the back, he's still losing his hair. We have to touch up. If we put it too low, we run out of graph. We have no more graph to fix it. You will have the big problem. This is the truth. Why I ask the patient, you just proportional ratio, do not put the lowest hairline. Another thing, please respect your surrounding hair or existing hair. You have to stabilize, stop slowing the hair loss. I show you of the my patient. This is me. I was invited to Spain to be a speaker about the nano fat for stabilize the losing the hair. We use nano fat for stop the hair loss. This is all of the patient allow me to show in the conference. All of these patient will not let them get the hair transplant. I show one of the result. This is one of the woman. She losing her hair, and then we fix with the nano fat without hair transplant surgery. This is the case. He losing the hair, and then I inject the nano fat, and then the result after 6 months the hair is regrowth again. But I said it's not success like this. This is of the case of the woman. This is the case that's the same case I show you. And the next thing is hair transplant is maybe cannot it's maybe not like an answer for every hair loss, because you know why? If you have some like underlying disease like this disease alopecia areata or diffuse pattern hair loss like a DUPA hair loss all the time, and you have the scarring alopecia on some condition, if you receive the hair transplant, the hair will not regrowth because your skin condition is destroy your hair. We have to make sure and check before you get the transplant you have no inflammation and the hair root. And this is one of the condition hair transplant is not a good choice. We treat this patient with the nano fat and alternative. This is one of the we treat with the exosome rich plasma. And the next thing I let have to, you know, we can make mission impossible to be possible. So many patients ask me, "Hey, Dr. Top, if I'm totally bald, can you get the hair transplant?" I said, "Yes." This is one of the case. He is 60 years old patient come to see me. "Hey, Dr. Top, I want to transplant. Can you do that for me?" I said, "Okay, no problem. If you're healthy, if you have hair for the donor area, we can try. Don't worry about the age, about the quality of the donor area, the hair in the donor area." This is one of the success case. This is one of the success case. Totally bald, we can make it. And even though this is the case, no hair, but we can make it. And another thing, doctor, if I have a burn scar, I want to treat. I have totally no hair. We can treat or not. Yes, this is one of the success story. In my patient, we take the hair from her back and then we move it to the front. It's a little bit difficult for the burn scar, but we can make mission impossible to be the possible. Next week, I'm not here. I was invited to be the international speaker in the MCAS meeting in Paris. After I come back, I will share the very interesting thing topic. Can we take the hair from the people to the people, like a mom and dad to their baby, their child? Yes or no? Brother, sister, or even though from human to human. I will share the slide with you and share the interesting case from Berlin. Okay, I will talk this topic next time when I come back from MCAS Paris. Okay, thank you so much for following me. Thank you. Bye.